Yeah, hi, how you doing? What would you like me to do? Just have some background. I can do this with almost no well, maybe a little background. I can close the door, get a little bit more stuff. What would you like? Let me see if I can, put my head in between these two pictures. How's that? Yeah, yeah, no kidding. I actually do other things, but not much. Okay, great. Thank you.
Building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We ask experts your questions every day at 3 to get answers for you in real time. Today, we're launching a partnership with the San Francisco Standard. We'll meet its news editor to talk about how this benefits our viewers and their readers. Also, amid the Supreme Court case that may result in the overturning of Roe v. Wade and guaranteed abortion rights, East Bay Assemblywoman Buffy Wicks shares her very personal story. But first, new testing requirements for travelers starting today, a new efficacy study about mixing vaccines, New York City's first in the nation mandate, and the latest on Omicron. Joining us now to talk about all these topics and more, UCSF epidemiologist Dr. George Rutherford. Dr. Rutherford, great to see you.
Good to see you too. How's things?
Things are good. I mean, good as they can be, right? Being cautious with Omicron.
Right.
right? Today, the new shortened window kicked in, right, for overseas travelers. You must have the negative COVID test within 1 day of the flight instead of 3 days now to be able to get on that plane and come into the U.S. So this was prompted by Omicron concerns. So what do we really know about Omicron at this point in terms of transmissibility, severity of disease? What do we know?
Sure. Well, it's a totally constantly evolving picture. And I can't really point to a single fact that's absolutely solid. What I can tell you, though, is that Omicron has spread quickly in South Africa, where there's a sophisticated surveillance system and appears to be displacing the Delta variant. But those are based on very, very small numbers because it was case rates were very low when this started in South Africa. So we're talking about dozens of cases, not thousands. So you have to kind of keep that in the back of your mind. The other bit of news coming out of South Africa is that the cases appear to be somewhat milder than we had feared. And so it's way too early to say that that's a fact. It's way too early to say that that's a trend. But at least the first level indications, and Dr. Fauci discussed this over the weekend, was that Omicron may in fact be somewhat less severe than the Delta variant, which would be very much welcome news.
Right.
In terms of transmissibility, probably about the same.
Okay, no wonder he said it was encouraging. If transmissibility is the same, but severity perhaps lesser, that is encouraging. And I did hear that latest case in California announced today, an LA County case, someone who is a college student on the East Coast came back fully vaccinated, again, mild symptoms. Any confirmed deaths at all, like globally from Omicron?
Not to my knowledge.
Okay. I mean, I know it's still early, but that is encouraging as well. I want to get
That's
back
a hedge against no, but anyway, I'm not. If I knew, I would tell you, but I don't. I'm sorry.
Okay, no, I get it. Look, about 45 nations, you correct me if I'm wrong, but I think that's how many nations have reported Omicron now. Do travel bans make sense at this point at all, given that, what we know about that?
I think the horse is out of the barn, and we should be backing off of travel bans here pretty quickly. They're quite disruptive to the economies of fairly fragile countries, and I think it's whatever purpose we're going to get out of them, we've gotten out of them, and I'd say we have we should, over the next week or so, we should be reconsidering this and backing down.
Okay. Dr. Rutherford, the vaccines we have now, of course, are not targeted to Omicron or, I think, Delta for that matter, right? But what is your thinking, right, on the level of protection offered to us, those of us who get the vaccine, have gotten the vaccine, in terms of Omicron?
Sure. There's the president of the South African Medical Association had a letter published last Thursday. And in it, she said, based on, a handful of patients, a couple of dozen patients she's treated, was that her impression was not only that it was less severe, but about half the patients she saw had been unvaccinated. And she did not differentiate, which is different from saying that she definitively said this, but she did not differentiate whether people who got vaccines were less symptomatic than those who didn't. I think it depends on what we're trying to prevent here. If we're trying to prevent transmission, which was obviously the most important thing to do if this were the more severe versions of the disease, that's one thing. The vaccine may not be perfect for that. However, kind of the very, and I mean by very, I mean very, 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 very early, suggestions are that people who are vaccinated are having milder disease. Now, there's a lot we don't know. That all that knowledge base could change tomorrow. But I think for right now, the basic advice is, keep doing social distancing, wear your masks when you go into our public settings, and please, please, please get your booster doses.
Okay. Speaking of booster, a new study on getting the Johnson & Johnson shot as a booster after Pfizer doses. I think they're saying it's more effective than, Pfizer original and then Pfizer booster. Can you explain that study?
Don't know the study. I'm sorry.
Okay.
There's some, NIH did some stuff very early on during the booster considerations. And what they found was that the people who had Johnson & Johnson and were boosted with the mRNA vaccines had very, very high rises in antibody titers. So that's kind of the information I'm going on. It would be interesting if it were, if the J&J vaccine could be used as a booster, because I know of certainly more than a few people who are hesitant to get another mRNA vaccine based on the symptoms they had from the second one back in the spring.
Yeah, I think this new study being reported on today suggests that if you got the J&J as a booster after Pfizer, it actually gives you more sustained protection or level of antibodies that doesn't drop off as quickly. If that is true, right, do you think we can extrapolate that to Moderna as well, where if you originally got the Moderna and you get the J&J, it would kind of be the same results?
Yeah, I mean, it depends on when it was done. I mean, unless this was done 6 months ago, it's hard to say whether they're going to drop off or not. I think that's probably, if this were done relatively recently, that's probably an overcall. But I'd like to see the study, and I'd be happy to, be corrected. But I'd be a bit skeptical of that right now.
Okay, Dr. Rutherford, look, if a lot of people are considering getting their first shots as a result of Omicron being in the news. So if you were new to this and you hadn't gotten anything yet, what combination do you think you would get?
I'd get an mRNA vaccine, either Pfizer or Moderna, whichever one was available to me. Of the two, Moderna has 4-week spacing and Pfizer has 3-week spacing between the first and second doses. So the virtue of the Pfizer shot is you complete your series a week earlier. The virtue of the Moderna doses, it may last longer. So it's 6 of one, half a dozen of the other right now. So it's kind of whatever you have available, get it.
Okay. Look, there's been kind of a rush to vaccinate, just judging on how hard it is to get an appointment here in the Bay Area. I think a lot of people are.
That's welcome. That's actually welcome news to me.
Right. So, I'm sure. But Dr. Rutherford, not necessarily in 5 to 11-year-olds, right? In that population, apparently only 20% have gotten at least their first shot. That compares to states like Vermont, which are in the high 40s. Of course, there are states that are lower, like West Virginia at 4%. But do you think that's okay? I mean, I'm thinking maybe a lot of parents are thinking because the adults are so well vaccinated here that's perfectly safe for their kids to not have to. What is your suggestion?
No. Kids need to get vaccinated for their own good. This is a leading cause of death in 5 to 11-year-olds. I mean, it's so overwhelmed by what happens in adults, you lose track of these things. But it's a major cause of pediatric death. It's the 8th leading cause of pediatric death in 2020. And it causes far more deaths than any of the other vaccine preventable diseases we immunize for. So children need to be vaccinated, period, over and out. There's some added benefits about schools and community transmission and transmission to grandparents and those sorts of things, but they need to be vaccinated for their own sake. The dose there are different doses for pediatric vaccination. And so it might be a little tougher to get because it's a different formulation. It's just a smaller dose.
Right.
And so, it might be a little tougher to get, but I would definitely get it. And in the Bay Area, and in fact, in San Francisco last week, it was 46%. And in Marin, it was 48% who had received the first dose. So when you start averaging across California, it gets very complicated.
Yeah.
But I think the Bay Area is performing much more like Vermont than West Virginia.
True. It's a big state. Look, Dr. Fauci also says he would not recommend anything different for the holidays, even if we see more cases of Omicron the next couple of weeks. Would you do anything different? What's your suggestion? What would you do?
Well, it depends on what your holiday plans are. If you're planning on going to South Africa on safari, I wouldn't do it. But, sort of short of that. And some of the European travel might be a little dicey, too, especially to Central and Eastern Europe, because there's a ton of transmission going on there. But if you're adequately vaccinated and boosted, I think you're in good shape. And I, for one, would not hesitate to go to Western Europe, Northern Europe, Southern Europe for the holidays. I mean, South America, Latin America, that's fine, right? If you're going to go to Asia or the Pacific, like Australia, you better be pretty careful that you understand what the quarantine requirements are, because you might spend your fabulous 2 weeks locked up at an airport hotel.
Oh, believe you me, I've been studying that, and that's why the cases are pretty low, right? They do have a lot of restrictions and quarantines. Dr. George Rutherford, we are out of time for today, but always great talking with you. Thanks so much.
Good to see you, Kristen. Bye-bye.
Bye-bye. Coming up next, as the Supreme Court takes up the issue of abortion rights, its impact on a local lawmaker. We'll be right back.
In commercial break.
All right, everybody, thanks for joining today. Always great to start the week with you. We don't have a commercial break question, but I want to get to a couple best I can. Brenda, I did see your question, Brenda Fee Madge, about Hawaii. So that is domestic. And just because you have to fly over an ocean, it's still the same. And that is if you're going from California, Hawaii does have its own restriction. It has nothing to do with the U.S. international, but they do require that you either have the proof of vaccination already uploaded, right, and approved, or you upload the test taken within 3 days, okay, not 24 hours. That hasn't changed, 3 days. And you upload that. If you don't do that, then when you land in Hawaii, you would have to quarantine. I'm not sure if it's 10 days still, but it was 10 days. So definitely they want people coming into Hawaii to either have the vaccine or a negative test taken within 72 hours. So those are the rules for Hawaii. Thanks for checking on that. And Martin, you have a question about what is required to travel to Canada and coming back. I don't know what Canada requires of Americans. I think it's a reciprocal relationship because the criticism for a long time was that the U.S. was not being reciprocal of Canada. So I think whatever it is, I think it's the same both ways. And, you know, but with Omicron, with the international, I think that may be the case where when you come back from Canada into the U.S., you may have to present the same, you know, test result within 24 hours of the flight. So double check on that. Go to the State Department. You know, if you're not sure, don't be stuck. All right. Looking forward to our next conversation. Eric, how much time do we have? How much time are you leaving for the last one? That's fine. Okay.
15. We're back in 10, 9, 8, 7, 6, 5 seconds, 4, 3, 2, 1.
The U.S. Supreme Court last week heard historic arguments over a Mississippi law that would ban most abortions after 15 weeks of pregnancy. Abortion rights supporters are concerned that the court's ruling, expected next summer, may spell the end of Roe v. Wade, the landmark 1973 case that promised women access to abortions nationwide. Experts believe if the High Court overturns or partially overturns Roe, 22 states likely would move to ban or curtail abortion further. 41% of women would see their nearest abortion clinic close, and the average distance they'd have to travel to reach one would jump from 36 miles now to 280 miles. Joining us now to talk about this and share a very personal story is Oakland Assemblywoman Buffy Wicks. Assemblywoman Wicks, thanks for your time today. Good to see you.
Thank you so much for having me.
When you heard the Supreme Court arguments last week and the justices' questions in particular, what went through your head?
I was infuriated. You know, as someone who, and this is why I spoke out with my own story, you know, a couple months ago in September, had some severe cramping and heavy bleeding and, you know, learned very shortly thereafter I was actually pregnant and having a miscarriage and needed an emergency D&C or abortion for my health and my welfare. And just felt infuriated that the Supreme Court is playing politics with my life and other people like mine. My story is not that uncommon. So I decided to speak out about it.
How many weeks pregnant were you when you had to do the emergency abortion?
I don't know because I did not know that I was pregnant. And, you know, I have two healthy girls, you know, and I had just been breastfeeding my youngest daughter, you know, and you have a lot of hormonal challenges when you're breastfeeding. So I wasn't having regular cycles. So I'm not aware of how far along I was, but literally the doctor said to me in one breath, "You're pregnant, you're miscarrying, and we need to do a D&C now." And while my circumstance would have been legal under the Texas law, and this was the week that the Texas law came into effect, the reality of the impact of these draconian laws could have had an impact on someone like me. And that's why I chose to speak out. Because if you look at situations, you know, like the Texas law, they create mass confusion for women around what their rights are. Yeah. They create a lot of fear. You know, in a place like Texas, the Uber driver can be held liable for taking a woman to a healthcare provider. Mm-hmm. And then ultimately, there's also a reduction in providers available. To your point, there's fewer and fewer places where women can actually seek care.
Yeah. I mean, yes, in your case, without the fetus being viable, you could have gotten your procedure done in those states. But when you're talking about states like Texas that want to make it, under 6 weeks, I think that's when a lot of women are just finding out that they're pregnant, right? And 15 weeks in Mississippi, that's what they're battling over. Isn't that when women can get the amniocentesis, right about the 15-week mark, to check on the status of your baby?
Yeah, and 6 weeks is so early. It's basically 2 weeks after you miss your period. But the bottom line is all of these laws, these draconian laws, the whole goal and mission is to reduce access across the board. Yeah. And that is what is driving this conservative movement. And so that's what we have to fight up against. And that's what I felt obligated to speak up against.
Look, even if the national guarantee of legalized abortion is gone, the availability of abortions in states like California would not change, right? In fact, do you think as an assemblywoman you would work to strengthen that right in California?
We have a very strong right here in California, which I'm very proud of. And as the governor has mentioned, we could become a safe haven for women who need reproductive care, which I believe is absolutely the right moral thing to do, to ensure that women have the access. But here's the other reality, and I use my situation as an example. I was doubled over in pain at 4 o'clock in the morning. There was no way I was going to go to the airport and get on a flight or drive 10 hours to the nearest state that offers care when you're in those types of situations. And for many women, they don't have the financial means to be able to do those types of things. So we're going to quickly create in these states that are going to continue to reduce access, the haves and the have-nots. The women that can afford it, they can go seek care elsewhere if time permitting. Yes. But for those that won't be able to afford it, they're going to unfortunately probably take measures into their own hands, which is going to be very harmful ultimately for their health.
Experts do point to the possibility of the two realities for those who can afford it and those who cannot. I want to turn to this. I think it's related. Last summer, it made the news when the Assembly Speaker denied you the ability to vote by proxy. You had to go to Sacramento while on maternity leave and vote on the Assembly floor with a 1-month-old baby attached to you. And we have that video right here. Look, there was a lot of uproar over that. And I wonder, what did that say to you about how much or how little you think we have in terms of support for women and new moms and where we need to go with this?
I think that moment spoke to a lot of people because many of us were living that sort of pandemic moment of parents juggling childcare responsibilities and work. And mine just happened to manifest itself on the floor of the assembly. But I come from a place of privilege. I can actually take my daughter to work if I need to. So many women don't have that ability. And if you're working 2 or 3 jobs, you're barely able to afford childcare, you're stretched at all means. Those are the women and the families that we really need to be advocating for. And I think that did spur a broader conversation around what are the policies that we have in place to ensure our families are healthy and happy and have those resources that they need, which is why I introduced more expansive paid leave bills this last legislative cycle to ensure that we have those things, which is why I'm excited about all the early childhood work that President Biden, those resources that he's putting into the Build Back Better plan. So I do think our elected officials have listened, and I think that we are seeing more movement on some of these policies. It just isn't happening fast enough.
Assemblywoman Wicks, that baby that was in your arms that we saw in that video, she's what, 1 now? How's she doing? 1.5?
16 months, and she's full of energy.
That's fantastic. I'm so happy. Do you think you having had the choice to have her was an important part in you being the kind of mother you want to be?
It is critical. And I spoke about this when I first got elected in January of 2019. My first floor speech on the assembly floor was about an abortion that I chose to have when I was 25. And I was, in between jobs, in between houses, in between relationships, and it was an unplanned pregnancy that I wasn't anticipating. And the ability for me to make that choice in my life at that time was critical. And I got to make that decision. And I look back at my life and what has since happened since that moment. I ended up working in the White House for Barack Obama and doing all kinds of other amazing things. And then having a family when I chose to have a family. And I have 2 beautiful girls now. And so the ability for me to make the decision on when I'm ready is absolutely critical. And it's a decision that every woman should be able to make on her own. And so that's why I feel so strongly about this. And I'm lucky, that I get to make these choices, and in California that we get to make these choices here. But if Roe v. Wade gets overturned, I really desperately worry about women in these other 22 states.
Assemblywoman Buffy Wicks, thank you so much for spending the time to share your own story today with us. Take care.
Thank you.
Coming up next, we're announcing a new partnership with a Bay Area news organization, what it means for you and what they're following right now.
In commercial break.
All right, everybody, hope you enjoy that conversation with Assemblywoman Wicks. We're going to take a short break. Let's see what beautiful shot our producer and director have for you. Enjoy. Part of building a better Bay Area is highlighting anyone in any group that's working toward the same mission that we have here at ABC7. The San Francisco Standard launched in January and shares the same mission. They've recruited a team of journalists with a goal to serve everyone with a stake in the future of San Francisco. And ABC7 News is excited today to announce a new partnership with the San Francisco Standard to showcase some of their deep and insightful reporting on the city. Joining us now to talk about that and a major story we're following, Annie Gauss, news editor for the San Francisco Standard. Annie, good to have you here.
Thanks for having me.
I know you are hyper-focused on San Francisco and like us with building a better Bay Area, want to give to viewers and your readers information that will help empower them to live better, safer lives. So tell us about the mission and work of the San Francisco Standard.
Sure. So as you mentioned, we're a new newsroom focused on San Francisco. We're growing really quickly. We're going to be about 25 people by next month, which is very exciting. And our whole mission is to help people to know their city. And what that means to us is helping people know, not just the people and the ideas and the creativity that make this such a dynamic place to live, but also, the politics, the policy, the governance, the economics, all of those factors that will, shape outcomes and shape the future of the city.
All right, you talked about politics. One of the stories you're following closely is the Assembly District 17 race in San Francisco to fill the seat vacated by David Chiu, of course, who's been appointed to the city attorney position. Why does this race take on extra weight and importance right now?
Yeah, well, there's a lot of interest in this race. The way this came about is, as you mentioned, David Chiu was appointed city attorney earlier this year, leaving this seat vacant. David Chiu served in that role for about 8 years. These seats don't necessarily, vacate just every day. So immediately we saw a lot of interest in this race. We have 4 candidates who are vying for this position, and in the assembly, this is a significant role. Obviously, this person will represent the eastern half of San Francisco and play a role in shaping statewide policy and representing the interests of San Francisco in the assembly. But it's a significant position as well, because if that person is an ambitious politician, they could wind up seeking even higher office. So all those things together, there's no surprise there's a lot of interest in this race.
Yeah, and this race is happening while redistricting is happening as well, right? I mean, the boundaries are being redrawn. How will that affect the race and maybe even the broader picture?
Yeah, so that's a really interesting thing about this race too. So this special election itself is to serve out the remainder of David Chu's term, and that will happen under the existing district. So the redistricting won't happen before that race. And by the way, that happens there'll be a primary in February, followed by a runoff in April to see who the ultimate winner is. But then there's another set of races later on in the year to basically serve out the new term. And that race, it takes place in June with the runoff in November. And that will happen under the new redistricting. So that's something that people are watching really closely, how that new district looks and how that might affect, who eventually takes the seat for the long term.
Yeah, boy. Okay. Annie, what other stories are you chasing right now that we should keep an eye on?
Gosh, well, we're covering, like I said, we're growing really fast. We're covering kind of all of the issues that tend to matter to San Franciscans. We write about housing, homelessness, public safety, education, small business. We're working on a number of exciting things. We have a story coming out next week that hopefully we'll have more to share soon.
All right.
But yeah,
we'll wait till then. I know we're out of time for now, but actually stick around. We can chat more over on Facebook Live. But I do want to share with our on-air viewers to check out the San Francisco Standard's reporting on the Assembly District 17 race. Just head to abc7news.com. We have a page with links to all their reports. You can also watch some of their videos with the candidates on the ABC7 Bay Area streaming TV app. We'll be right back. Annie, thank you so much. And I do apologize for the interruption.
Yeah.
Darn commercial breaks, have to pay the bills. But, but I know you were talking about the race. We do know Haney's in it, right? David Campos, who was a supervisor back in. Who are the other two candidates?
Right. So there's David Campos, Matt Haney, who represents District 6 in San Francisco. The other candidates are Bilal Mahmoud, who is not a career politician. He has a background in science, technology, and was a policy analyst for the Obama administration. And the fourth candidate is named Thea Selby. She's a neighborhood activist, and she also serves on the City College Board of Trustees.
I see. In terms of the political spectrum from very left to left of center, where do they tend to fall?
Yeah, well, what's interesting is that, one of the things that really came out when I was doing this reporting is kind of how narrow the political spectrum really is. I was moderating a debate with these four candidates, and there was this lightning round that happened where it was like, yes, no, on a whole set of issues. And they were totally unanimous on all of them. But, there's where the differences kind of tend to come out are when it comes to housing and what the state's role should be and setting local housing policy. Education, they had some varying views on the recalls of the 3 school board members in San Francisco. So once you actually sit down and talk to them, you do see a little bit of divergence in some of the views. But it's San Francisco, everyone's pretty progressive. So
indeed, yeah, no, that's very interesting. I'm going to jump right on your website and read everything you got on that. That lightning round sounds very fascinating. Annie Gauss, that's great. Nice to meet you. I'm sure we'll have many more such conversations. Take good care.
You too. Thanks so much.
Thank you. All right, everybody, in the home stretch. Hope you enjoyed the show today. The San Francisco Standard. Check it out. We have a new partnership with them. Just go on our website, abc7news.com, and you'll see links to their reporting.
9,
all right.
8, 7, 6, 5 seconds. 4, 3, 2, 1.
Thanks for joining us today. We covered the latest with travel, the Omicron variant, and the Supreme Court take on abortions, abortion rights. We'll be here every weekday at 3 on air and on live stream answering your questions. Back at 4 o'clock. See you then.